Hello, NephU community. This is Dr. Shirin Sundar, Senior Medical Science Liaison with Otsuka Pharmaceutical Development and Commercialization. Today, I will be giving you a preview of the resource Empowering Patients Through Health Literacy. For more in-depth information on this topic, please visit nephu.org. This program is paid for by Otsuka Pharmaceutical Development and Commercialization, Inc., and I am an employee of Otsuka Pharmaceutical Development and Commercialization, Inc. What is health literacy? Health literacy is defined as the capacity of an individual to understand information related to a disease in order to make an informed decision. But health literacy goes beyond just being able to read. It involves oral understanding, numeracy, and cultural and conceptual knowledge. We know that patients with kidney disease have a complex care pathway. They may have to follow dietary restrictions, complex medication regimens, keep up with multiple healthcare appointments, and make difficult decisions about dialysis. So, adequate health literacy is particularly important for empowering CKD patients in their own care. We know that limited health literacy is common in patients with CKD. This is especially an issue during decision-making for dialysis, and the Renal Physicians Association as well as the ASN have come out with clinical practice guidelines for engaging patients for dialysis decision-making. Patients with low health literacy tend to have worse outcomes in the setting of chronic medical conditions such as hypertension, diabetes, asthma, congestive heart failure, and end-stage renal disease. For instance, 92% of patients with adequate health literacy were able to identify the blood pressure cutoff for hypertension, while only 55% of those with low health literacy could do the same. Among patients with diabetes, 94% and 50% of patients with adequate and low health literacy, respectively, recognize the symptoms of hypoglycemia. Patients with low health literacy were found to have an increased risk of death following hospital admission for acute heart failure as well. So how can we recognize patients at risk for limited health literacy so that resources can be provided to empower them? Here on this slide are some clinical red flags to spot limited health literacy. Forms that are incorrectly filled, non-adherence to medications, missed appointments, and lack of follow-through with tests, etc. Patients may also not be able to explain what their medications are for and may offer excuses to deflect reading tasks. A major red flag is when they have difficulty expressing their medical concerns. Hope you enjoyed this preview to the full presentation of Empowering Patients Through Health Literacy. This makes you eager to learn more about how to help improve health literacy and empower your patients. Please visit nephu.org to request a full presentation from your local medical science liaison or managed market liaison. See you at NephU.